Hello, everybody, and welcome back to the Dr. Mike and Shannon Show. I am medical technology specialist Shannon Fanenstein with Mazon Medical, representing the Euro Valley BRS. And we are, of course, joined by Dr. Mike Bradley. Dr. Mike Bradley, I know everybody knows your name, but they may not know your background. So can you let everybody know what your background is?
And it's true, they might have just clicked on this video. It's the first time they're coming to the Mike and Shannon, show or here on our channel at YouTube. So, I'll introduce myself. I'm Dr. Mike Bradley. I am the Chief Medical Officer for Mazon Medical. I also work as a certified pelvic floor specialist with UNLV the School of Medicine down here in Las Vegas. And I also work pelvic floor specialties throughout not just Nevada, but also in California and Arizona. And I might possibly be doing some stuff in New Mexico. So we'll see where I end up when all of this.
Virginia. We've got Virginia.
Yeah, you never know.
The DMV.
Yes, right.
Which is where I'm at.
Right. So, I'm excited about today's conversation for a few reasons. Go ahead and introduce what we're going to talk about, Shannon.
Yes. So we just had our pelvic party, which was a huge success. And we had a lot of conversation about, pelvic floor therapy, but many of my contacts, listeners did not realize that there is pelvic floor therapy for men.
Right.
And it's actually not something until I've started working in this field that I didn't know about either. So let's go ahead and talk about that today so we can educate our men out there.
So for the men out there, there is hope, and you're going to have to be more diligent, I think, than the women to search for that help. But let's talk about pelvic floor rehabilitation for men. So a lot of times when I'm doing pelvic floor rehabilitation for men, I'm doing it with my urologist, right? I'm working with my urologist. They're the ones that are referring to us. At a urology office, surprisingly enough, it's not a 50-50 split between men and women. It's more of a 80-20 men to women ratio, unless you're a urogynecologist. And a lot of those work together in specialties, right? So with our men, when we're doing pelvic floor rehabilitation therapy, we are doing a couple of things that are very similar to the women. The first thing we're doing, of course, is a bulbocavernosa reflex. We're looking for if it's a neurological problem or a muscle physical problem that's causing the symptoms. But before we go into treatment, let's talk about some of the symptoms that we see from our men at pelvic floor rehabilitations through their urologist. Number one symptom that a lot of men have, let's talk about like the least gross before we get into the really gross ones. Does that sound good, Shannon? So can
we backtrack for a second, because you did mention going and doing the bulbocavernosus reflex. So for people who are on here who aren't aware, it is under the Merck manual, checking that bulbocavernosus reflex is one of the protocols. And this is something that can be done quite easily and quickly, pain-free, no electric stimuli, non-invasive with the Euroval BRS. It's done in and out, it's done less than 5 minutes.
It's the first protocol. It's the first guideline. When you look at the Merck manual of adults with incontinence, the very first thing they talk about you doing after you get the history is you do a test that basically confirms nerve functionality. And the best, safest, easiest, most objective test that exists is the bulbocavernosa reflex, the BRS test that we have with Mazon.
And it's reimbursable, which is also very important for a practice.
So whether you're a general practitioner looking to be able to determine if there's a neurological issue, to give that to your patient before they send them off to a urologist, or you're a urologist that wants to know before they do something crazy like urodynamics, is there a neurological issue or not? This is what you're supposed to do per the Merck manual. It is the guidelines. So if you're not
then once we find that is, now we're on to step number 2. Now they have that data. Right. So now step number 2.
They go from assessment to true diagnosis, and that's the way you're supposed to do it. Assessment is, am I looking at this or am I looking at that? Diagnosis is, I'm looking at that. This is what's causing it, if that makes sense. So with our men, they go in, they get a bulbocavernous reflex because I need to know if it's neurological or not, right? I want to know if it's an enlarged prostate, or if it's, if it's weak pelvic floor, or if it's a spinal injury, what's causing that. And you can't really do it just by listening to symptoms. But let's back up a little bit too. The very first thing it says to do in the Merck manual is history. You always do history first. You want to know what brought you to see me in the first place. What's the history there? Next thing you do, bulbocavernosa reflex or some type of neurological evaluation. And it's my belief, and from my experience, a lot of people don't know how to do that. And it's because, they don't have an easy test like this BRS system to be able to do it. After you get that, then you get into more like uroflow and, maybe urinalysis, or you might, it gives a huge list after that neurological thing on tests and different things that we can do to patients to be able to properly diagnose, even into urodynamics. But what's interesting is if you look at the urodynamics table on the Merck manual, it gives diagnoses, what could be, what could happen. It says neurological, non-neurological. When you're doing your urodynamics test, you're supposed to do this test first. And from that, be able to determine, after you do urodynamics, what's the cause of this? Once we get the cause figured out, we're able to determine a way to fix you, right? That's kind of how it works. We diagnose and then we treat. So what brings a lot of men to come see us in the urology space or the pelvic floor rehab space? I'm going to talk about, like I said before, the least, nasty, gross one to the more. Right. And women, you're going to love this a little bit. So us men have a condition sometimes called post-void dribble. And what this is a man goes to pee, pulls his underwear up, and a little spot develops right on the front. And women hate that. They hate it because it's a washing machine situation. It actually, believe it or not, creates a little urine smell right there in the front. And a lot of men don't realize that is a form of incontinence. And there are ways.
Well, you think of also too, you're a man, you're just went to the bathroom. Now you're walking into that important business meeting and you have a spot on the front of your pants.
On the front. Yeah.
Yeah. It's a little embarrassing.
Yeah. If it goes through the underwear and into the front of the pants, boom, you got your spot. Yep.
Now you're standing in front of the dryer.
Yeah, exactly. And you know what's crazy? Most of us men don't do it. We just walk out because that's how guys are, So, it's a funny conversation, but that is one of the things that I think is probably a sign of something, possibly neurologically, possibly not, but it's a sign of something, and most men ignore it. But that's one of the first things that I would say is probably the least disgusting thing. ED, common thing. Do you know if you've got neurological ED or if your heart's just not giving you enough blood flow? We know for a fact with bulbocavernosa reflex, if your neurological delayed latency time is beyond a certain point, Viagra is not going to work for you. If you got neurogenetic ED, all you're doing is taking heart medications that wouldn't work for you anyway. Kind of handy to know. It makes sense why the Merck manual would say you should do neurological tests first on patients with incontinence, probably with patients with ED. You should check and see if you're dealing with neurological ED or non-neurological ED. Some other symptoms that happen with men, they can have stress incontinence where they sneeze and lose a little bit of urine. A lot of times with men, it's working out, like they'll lift something heavy and they'll lose urine. That is stress incontinence. That is a diagnosis. That is a treatable condition. That is something that happens. A lot of patients don't want to talk about it because they think it's a normal symptom of aging. And I'm here to tell you that is not the case. I have done as old as 103 successfully and reversed their incontinence situation. 103. That tells me.
And which situations would warrant then going for a man to go through pelvic floor therapy?
So we see a lot of people that have that post-void residual. We have a lot of men that have streaking in the underwear. That's fecal incontinence, streaking in the underwear. So they get the nice little streak. Another thing that women love when they're doing the guy's laundry. What's this about, right? Nobody wants to see streaks, spots,
no.
stuff.
Yeah.
We deal with, of course, any kind of stress-based incontinence. A lot of men have hesitation and they think it's prostate related. Sometimes it is, sometimes it's a weak pelvic floor. Their body doesn't relax properly because the nerves aren't firing correctly. And because of that, they hesitate. They sit there and they're waiting forever and a day to finally get that system to work to pee. It's called hesitation. Again, something that could be and probably should be checked for is a neurological condition causing that problem. Should also check your prostate, make sure you don't have a blockage, but that's what your urologist does. So it's there's pelvic pain with men. Men have pelvic pain, groin pain, there is frequency. I don't know how many men are getting up 3 and 4 and any more than once a night to go to the bathroom. That is frequency, and that's destroying your sleep, and that's going to cause all kinds of health issues beyond the pelvic floor later on in life because you're not getting enough sleep, which, by the way, is the #1 killer of people. Lack of rest, #1. Look it up. So it's one of those things that, when we see people that have these issues, whether it be men or women, there are fixes, there are ways to help. You get properly diagnosed, right? And then you can find somebody that knows how to fix that proper diagnosis. And that's what I want everybody to strive for, is working with your physician, working with your specialist to get properly diagnosed, men or women.
And we're going to actually have a video coming up of a tour of a pelvic floor rehab facility and go through what it is that is actually done. We're going to be doing it on one of your facilities, so that way we can talk about, what actually happens when you are going through pelvic floor rehab. What are the differences between the pelvic floor rehab and pelvic floor therapy, so that we'll go more in depth on it, so that way you understand when a provider is talking to you, they're not the same. That's something I didn't understand was different. And I'm in the field, and it took me a long time to understand what was that difference. So, we're here to be able to help better educate you, so that way you understand what your provider is talking to you about.
Right. To make it more understandable to the layman, and to also make sure that there's awareness. Because I think that that's one of our bigger problems in the medical industry. People are just not aware that what they're dealing with is maybe a symptom of a problem that could be fixed. I hate the idea of people living with things because their quality of life suffers,
Right. Again, you go into that, powerhouse meeting.
There was a study.
Where are they staring at you?
there was a study that suggested that incontinence weighs just as heavily on the human mind as full-blown depression. And that didn't state that it was a female issue, male or female, that literally this problem of incontinence is not talked about enough. And it creates so much anxiety that it is right up there with depression. So it's something.
Well, yeah. I mean, you're constantly thinking about, where is that bathroom? Where am I going to get there in time? Because, I mean, we had talked about this in a previous video. Some of these people are locked into their homes because they're so afraid to go out, because they don't know if the anxiety level is so high. They don't know if they're going to be able to find a bathroom, make it to a bathroom.
Yep, fully agree. So that being said, that's my take on our good men and what they would do in a pelvic floor rehabilitation program. It would be, for guys, I won't say that it's painful. I would say that it might be a bit embarrassing to do a manometry. There are certain places that we go with these balloons that men may not appreciate too much, but I got to tell you, it's short-term lived embarrassment for a lifetime of health. We also do electrical stem. I do electrical stem, and that stem should never hurt. It shouldn't be a negative part of your day. It is something that you got to come in and do. The pain of just, taking on these problems is a part of what we have to teach people. But the reward is beyond that point forever. And it's worth that time and effort to get rid of that anxiety and to get into those boardrooms with all the power that you should have as a guy. To be able to close that deal.
Should we do the old what was that with Tim Allen go
yeah
tool time
tool time for your pelvic
tell
floor.
you how
a great
old
name.
I am.
That's a great name for this video. Maybe we'll call it tool time for the pelvic floor. That would be great.
Oh, that should be our, instead of the pelvic party for,
Our next one
our
for
urogynes and our
Yep,
gynecology.
guys.
There
we'll
you
get
go,
those-
guys. We're
Yep.
gonna have tool time for the men. We'll get
Love it.
Dr. Chris on for that one.
That's why I love all these videos that we do, because it really gives me some great ideas.
Yeah, so we want to thank you again for joining us for our Dr. Mike and Shannon show. And please, if we would appreciate that you like, subscribe, and share to your friends and family. This is how we keep the videos going. Any last thoughts, Dr. Mike?
Just stay healthy out there. That's all I can ask. Stay healthy.
Yes, we really, really appreciate it. And thank you and have a wonderful day.